Hey friends, welcome to we're going to talk about spays and neuters today and our options. So it's not about being anti-spay or anti-neuter. And we're going to talk about the trade-offs when you spay and neuter versus doing alternative procedures or keeping your dog intact. And we're going to go over the research. So and I'm gonna shut down my there we go. All right. So there's no judgment here. We're going to just go over all the facts and I'm going to educate you and empower you to make good decisions for your pets. And if the decision has already been made for your pet, like in the past, um, we will talk about that in another video. Um, just want to make sure that you know that this is not medical advice. Every dog is going to have a different situation, so things are going to vary. There's no right answer for every dog. All right. So I put up a post on Instagram that got a lot of likes and a lot of hates. So I wanted to clarify things so people were um, informed on what the research says. So there is research now. There's a lot of research now. The other reason why this conversation is happening is because spays and neuters um, were very common before long-term health data ever existed. Nobody bothered to look at what was going on. And over the last 20 years, researchers have been tracking things. They've been tracking things like cancer and joint disease and immune problems like hypothyroidism and behavior. And in those decades of tracking these illnesses, some of the results they got from the research studies and when they look back on things um, were really quite unexpected. So UC Davis did some really interesting breed specific studies starting in the early 2000s. So there's a lot of data out there, and I'm going to kind of mix that in today. So what exactly is spaying and neutering? So spaying and neutering um, removes the reproductive organs. So a dog can't reproduce or um, make puppies, um, and they can't or they don't have the hormones um, from those reproductive organs anymore. And the hormones, and we'll talk about this in detail, those hormones that come from the ovaries and the testicles affect things like bone growth and immune system and metabolism and the brain and behavior and all kinds of things. So let's kind of take a step back and talk about how the hormone system works physiologically. So the brain body loop. So the brain has the pituitary gland, and the pituitary gland sends out signals to different parts of the body. And one of those signals is luteinizing hormone. And in a dog that is not spayed and not neutered, that pituitary gland releases the luteinizing hormone, which tells the ovaries and testicles to make estrogen or testosterone. And then these hormones travel back to the brain and tell the pituitary gland, okay, we've got enough hormones. You can slow down production now. And the system stays balanced and regulated. There's a feedback loop. So, what happens when we spay or neuter a dog, when we take away the ovaries, we take away the testicles, the pituitary gland doesn't realize that we've taken away those reproductive organs. So the pituitary gland keeps releasing luteinizing hormone, and there's no ovaries or testicles to respond to that. So the pituitary gland never gets the stop signal. It just keeps releasing luteinizing hormone in high amounts and never gets shut off. It's like the doorbell that keeps ringing and no one lives there anymore. So, the reason that this constantly high level of luteinizing hormone that's coming from the pituitary gland that never gets shut off affects the whole body is that there are luteinizing hormone receptors all over the body, including the bones, the joints, the immune system, the thyroid, the adrenal glands, the brain, blood vessels. So it's not just something that affects reproduction in the ovaries and the testicles. So we have found that the luteinizing hormone has effects in multiple systems in the body. So that means luteinizing hormone is pushing the buttons in all these different parts of the body. And those buttons were never meant to be pushed all the time. Like it's an on switch that never gets shut off. And so what we're finding is that this increase in luteinizing hormone increases the cancer risk in some of the tissues in the body. It can cause joint and bone problems, immune system imbalances, anxiety, and cognitive issues. And this doesn't happen to every dog, but it happens in some dogs, especially large breed dogs, we're finding. And that constant luteinizing hormone stimulation contributes to all the chronic diseases we're seeing. So after spay and neuter, the pituitary gland keeps releasing luteinizing hormone because it never gets the stop signal from the ovaries and testicles. And that lifelong hormone signal may affect the other organs in the body. So you might be thinking, okay, so what about if I spay or neuter my dog later versus early? Like, does that help? And that was one of the questions that came up. So there are risks and benefits there of um, early spays and neuters versus late spays and neuters. And it's a timing question. And it really, again, depends on the dog, the individual. So early spay and neuter to be like pediatric spay and neuter. So before puberty, usually about 6 months of age, 6 to 9 months of age, and sometimes a lot earlier. So the shelters will spay and neuter like at 8 weeks. That's super early, but that does happen. And then later spay and neuter would be after the dog has reached sexual maturity, usually around 18 to 24 months of age, which is especially important in the large and giant breed dogs, mainly because small breed dogs will mature faster. So they're ahead of the game. So early spay and neuter came about because of population control. It was a quick and dirty method to stop the high euthanasia rate in the shelters and the overpopulation with dogs everywhere. It prevented accidental litters. The shelters were um, this was a really important procedure for shelters to prevent what they were seeing on a daily basis. And it reduced the euthanasia rates because that is super sad. We shouldn't be euthanizing dogs just because we can't find a home for them. That's the saddest thing in the world. But the other things that contributed to why early spays and neuters started being done is because of surgical convenience, meaning it's a faster surgery, it's an easier surgery, it's a smaller incision, you've got a shorter anesthesia time, and for, veterinarians, it's definitely an easier surgery than if you had to spay a 80-pound Labrador at 2 years of age. Yeah. The other thing is, it eliminates when you spay early, it eliminates the heat cycles. So no bleeding, no um, attracting the males in the neighborhood, no chance of pregnancy. So those are some of the reasons that the early spays and neuters came about. But there are health risks with the early spays and neuters. And, we're talking about things that can happen um, more commonly when you spay or neuter before a dog finishes growing. So things like orthopedic and growth problems. So the sex hormones, the testosterone and the estrogen, will tell the growth plates when to close. And if the hormones are removed too early with a spay or neuter, um, the growth plates will close later than normal, and so you'll have abnormal growth of bones. And the bones can grow longer than intended, and then the joints don't align properly. So that's what happens with the orthopedic issues we see with early spays and neuters. And then as a result of that, we also see an increased rate of cruciate ruptures, the ACLs, and hip dysplasia, and elbow dysplasia, and arthritis showing up earlier than usual. Um, and the research is in the UC Davis Vet School studies, and also the Journal of Small Animal Practice has a nice review on this. The other thing we see with the early spays and neuters is increased cancer risk. So, and especially in the large breed dogs. So, when they lose their hormones early, it increases the risk of osteosarcoma, which is bone cancer, hemangiosarcoma, which is blood cancer, and lymphoma, which is like lymph node cancer. And it seems like the large and the giant breed dogs are affected the most with that situation. The other thing that we see with early spays and neuters, um, with the females, when they're spayed early, they have an increased risk of urinary tract infections and urinary incontinence. And a lot of us have seen that. When we have a spayed dog, they start leaking. And that's because of the lack of hormones, lack of estrogen. So so spaying and neutering will increase some risks, and it's called the spay neuter syndrome. And the spay neuter syndrome means that with early removal of hormones, you're getting a that surge of luteinizing hormone that just keeps getting pumped out by the pituitary gland and causes hormonal imbalances. And when dogs are spayed and neutered early, they have more exposure to that high rate of luteinizing hormone than if they were spayed later. Yeah. So the other risks of the early spays and neuters are obesity, immune-mediated diseases like hypothyroidism, and then also anxiety and fear behaviors with the early spays and neuters. Some people have actually noticed fear behaviors showing up right after a surgery. It's kind of weird, but it happens when you remove those hormones abruptly. So, the benefits of waiting until a dog is mature, so maybe 18 to 24 months of age, is you've got normal growth and development of the joints. The growth plates close naturally, so you have less orthopedic problems. It can also potentially lower the cancer risk, especially with the bone and blood cancers, and especially in the large breed dogs, which are the ones that are prone to a lot of the cancers that are related to the high luteinizing hormone after they're spayed and neutered. And if you spay and neuter these guys later, theoretically, they have a shorter lifetime exposure of that high luteinizing hormone from the pituitary gland. So it may reduce, the overall amount of hormones that uh, they're exposed to. But then, what are the downsides of waiting? So maybe the dog gets pregnant. So you have to be responsible and make sure your dog is supervised and trained, and you've got fencing, and sometimes things happen and the male dog pops over the fence and then your dog is pregnant. The other downside is with the females, you've got the heat cycles and the bleeding and the attraction of male dogs. And so you've got to kind of be prepared for that. And then, behavioral management, especially in the um, unneutered males, they may roam and mark, lift their leg on everything in your house. So this is where um, behavior management and training comes in. Um, doesn't happen in all dogs, but it can. And then with the small breed dogs, it seems to be with the little dogs, since they mature faster, they're not as affected as the large breed dogs. So in general, they have less of an issue with cancer and orthopedic problems overall. But this doesn't go for everyone. So, these aren't mass generalizations, they are trends that we see. And your decision is going to be based on your particular dog and your particular situation. So, you know, early spay and neuter is not really the recommendation, because a one size fits all approach is really not appropriate anymore, especially for large and giant breed dogs. Um, so the earlier a dog is spayed or neutered, the higher the risk of joint growth problems, um, the higher the risk of certain cancers, especially in large breed dogs. Um, and then on the opposite end, if you wait till they're physically mature, it reduces these risks a little bit. So while, spay and neuters saves millions of lives, we're now learning how to fine tune it. We're learning, that timing can be protective for long term health. So let's kind of jump into some of the chronic diseases that we see with spayed and neutered dogs a little bit more in detail. And then I just want to be clear that this is not a guarantee that your dog will get it. It's it's a risk. So you have to be aware of the risks. And there are a lot of things that will play into this because there are a lot of variables with the dog's immune system, and it depends on a lot of other things like the water they drink, the food they eat, the environment they're in, how much stress they're in. It depends on so many other things that you can't just tag it onto, being spayed or neutered. Yeah. But the what we're seeing, what the research is seeing is, um, after spay and neuter, the cancers that are increased in dogs are hemangiosarcoma, osteosarcoma, and osteosarcoma is a 2 times higher risk in large breed dogs that are spayed and neutered. Lymphoma, bladder cancer, which is transitional cell carcinoma, and aggressive prostate cancer in neutered males. So those we're seeing more in our neutered and spayed dogs. We're also seeing more ACL tears. We're seeing more hip dysplasia and earlier arthritis. So stiffness and pain showing up a lot earlier in dogs before they're getting real old. And then we also see chronic conditions like obesity, urinary incontinence, and autoimmune diseases like hypothyroidism, as well as anxiety and cognitive decline. So those are all increased and have an increased risk in your spayed and neutered dogs. But on the flip side, we have health risks in intact dogs. So let's kind of go through that so you can kind of see the balance. Because keeping a dog intact is not risk free, it's just a different risk profile. So, with the females, if they're intact, everyone worries about pyometra or a uterine infection, which can be fatal and requires emergency surgery and emergency spay. The other risk is mammary tumors, and mammary tumors have a slightly higher risk in intact dogs. Although the good news is most of them are benign and treatable. And there are research studies to show that. And with the intact males, we see more benign prostatic hyperplasia, the BPH, where the prostate just swells up and pushes on the colon and pushes on the urethra and causes problems going to the bathroom. And we also see an increased risk of testicular cancer in the intact male dogs because they still have their testicles. But the good news is testicular cancer is usually slow growing and it's highly treatable with surgery. Um, so after we look at the risks of the spayed and neutered dogs and then the risks of keeping your dog intact, um, how can we reduce that risk um, on both sides? And uh, some new surgeries that have come into um, popularity, which is great, are the hormone sparing sterilization surgeries. So, for example, with female dogs, an ovary sparing spay, where we remove the uterus but keep the ovaries. And that prevents pregnancy and it prevents pyometra, which is one of the things that a lot of people are worried about. And it preserves the hormones and the normal luteinizing hormone regulation. So the ovaries are still there. So when the pituitary stimulates those ovaries, it gets that feedback loop and gets shut off when there's enough. With the male dogs, um, we can do a vasectomy, and that prevents them from reproducing, but it also keeps the hormones in the testicles and lowers the risk of joint disease, bone cancer, cognitive decline, that kind of thing. The interesting thing is there's a lot of behavioral myths out there. And one of the myths is if your dog is aggressive, you want to neuter them or spay them. But what the research actually shows is that neutering does not reliably reduce aggression. And actually, neutered dogs or spayed can show more fear and more anxiety. So that's not a slam dunk. So we can't use that. So, what if your dog is already spayed and neutered? So, some dogs do develop this spay neuter syndrome where they have that luteinizing hormone being produced all the time and flooding the body with luteinizing hormone, which is causing some of our chronic diseases, um, like the joint pain and weight gain and anxiety and incontinence. Um, there are ways to restore hormones, which will help lower that luteinizing hormone and improve quality of life. And I'll go over hormone restoration in um, a different video. We'll go over that maybe next time. Um, so let me just put up a QR code for the Parsimus Foundation. Um, Here's a QR code for the Parsimus Foundation, and they have um, compiled the research and compiled um, all the current surgical procedures and information. And they also have a find a vet function, so you can look up a vet in your area that may do that surgery, may do a vasectomy or ovary sparing spay surgery for your dog if you're interested in that. And then let's see. All right. So, when you're trying to make decisions, um, if you have a young dog, it can be it's a tough choice and you have to reflect on things. Like you have to think about your dog's breed and what diseases might be more prevalent in your dog's breed. um, how large your dog will be. So if you have a large or giant breed dog, they're going to be more prone to problems if we do an early or even any spay or neuter. And then you also have to think about, can you if you keep your dog intact or just do a home hormone spaying surgery, can you manage that dog? Because like with the females, ovary sparing spay does not remove them from going into heat. They will still go into heat. So you want to kind of discuss that with your vet. If they're not aware, of all the alternatives here, um, you can jump on a Zoom call with me. Let me grab that. So here's a link to a pet health strategy session, and you can just um, take a picture of the QR code, and you can schedule a 30-minute Zoom with me, and I'll answer all your questions, and we'll kind of figure out, what the risks and benefits of and what the best option is because it's all very individual. So, spays and neuters save lives. Um, we're learning more about this. So as we know more, we do better. And it's a choice. It's not a judgment. And you're asking really good questions. So, and that's the important thing is you're asking the questions because if you're relying on, what we used to do 30 years ago, medicine has changed a lot since then, and we've gotta change with it, and now that we have research in the last probably, 10 or 20 years, we've had research coming in, and so now we're seeing the links between things where we didn't have that before. Yeah. So I'm gonna, um, I have posts on my Substack that are more in detail, and I'll also have a post on my Substack about hormone replacement. So join me over there. You can scan the QR code and join me over on Substack, and I'm going to get kind of into the weeds of spays and neuters and hormone replacement. Yeah. So I hope this helps some people kind of get a better handle on, spays and neuters, keeping your dog intact, or maybe an alternative surgery um, to prevent pregnancy, prevent pyometra, prevent reproducing, but keep the hormones and prevent a lot of the chronic diseases that we're seeing. Because honestly, I'm seeing a lot of these chronic diseases that I didn't see 30 years ago. I've been doing this for almost 40 years and I didn't see all these ACLs and all this cancer. I just did not see that early in my career. And now I see it every day and I'm managing cases for people every day. And so, this is one of the variables we have options for. So this is just, exploring your options today. All right. So I hope that helped. Next time we'll talk about hormone replacement and the options you have for that if your dog is already spayed and neutered. There are options for natural hormone replacement and conventional hormone replacement. So the HRT in dogs. Thanks for joining me today. I'll talk to you later.